I'm Jack Langenbrunner, and I'm a senior program officer at the Gates Foundation. Why did the foundation think about investing in this area? Well, I think we know a lot about upper income countries, the OECD countries. We know more and more about middle income countries, but we know so little about low income countries. And we know so little about how they actually go from being a poorly performing system to a well-performing system. And of course, many people talk today about leapfrogging, low-income countries not making the same mistakes that other countries have in the past, but actually moving very, very quickly. And that's possible with good IT systems, for example, that we didn't have 50 years ago. So this is the beginning. We're really trying to understand right now what are the lessons, what have countries that have succeeded, how have they learned, what have they learned, and how have they learned, and how have they taken that information from other countries and used it to their own advantage, because they cannot take it and just put it into their own system, kind of cut and paste. No, it has to be contextualized in a very nuanced way. So we're trying to learn those things, and once we learn those things, it opens up possibilities for how we can invest in the future. Well, certainly there's a technical aspect, and certainly there's a political economy aspect, right? So you need good design, good strategy. You need to think about both what economists call the demand side, how money is moved, and you also need to think about the supply side, where providers are, if they're available in the right places at the right times. But at the same time, there's a political economy dimension where there's a political will to actually move forward and to change things, because these reforms do change how money moves, and there are winners and losers. Well, certainly there are some general principles that every country needs to think about: good human resources, ways to bring the right inputs in terms of materials and supplies to the provider, incentivize providers that really are keen on reaching the highest quality at the lowest cost, to make sure that care is accessible to not only the rich but also the poor. So these are the kinds of things that you find a challenge in every healthcare system, an objective in every healthcare system, ultimately to achieve better outcomes, ultimately to achieve better financial protection for patients, ultimately to be responsive to patients, to their needs. So these are the things that you find in every country, but how countries actually achieve those goals often are very country specific. And there are good lessons that emerge all over the world. Rwanda is one such case in Africa, made enormous strides in the past decade. But there are other countries as well. If you look across the road at Ghana, they've made some very important gains in the last 10, 15 years. So that's a kind of interesting thing for me, is that often countries find themselves at a time of real challenge across the entire economy, but yet leadership realizes this is the time to reform, this is the time to change. There may be a real need to think more clearly about how to use the funding they have for both efficiency and equity purposes. And we have seen that in every continent of the world.